purpose of this training video is to give students an introduction on how to do an oral presentation as junior clerks. Giving an oral presentations to your healthcare team when you're on rounds is a challenging thing to learn. Let's first take a look at a bad oral presentation. See how many problems you can identify.
How much time we got left?
Not much.
All right, Dave, let's go.
You're up.
Yeah, let's go.
Me?
Yeah.
Oh,
Come on.
Come on, tell us about your
I don't
patient.
really remember this patient, but it's Miss Doe Jane, 87-year-old female, came in with what does she have again? Pain in her epigastrium. I think that's right on here.
What's her MR number? Do you remember?
Yeah, I don't.
How old is she?
I have
That's
that
it, don't worry,
somewhere.
Don't worry about it. Just go on. Go on.
87-year-old female came in with some pain, epigastrium, dull, 10 out of 10. Her white count was 15.4. 3 weeks ago, started.
Has she been here before?
She, we couldn't find anything in the medical record.
Did you actually see her?
Yeah, I saw her. It was a late night.
Okay, well, keep going.
Yeah.
Just give me what you got.
So yeah, I had a white count of 10.4. We made her NPO and gave her some IV fluids. I don't know if that's the right thing. I don't know if that's what we should have done. But
I don't know much about her.
Last bowel movement normal yesterday. EGDs,
You got 2 minutes.
EGD a couple years ago, some gastritis, I think. She's on.
Do you have those records too, or what did they say?
You know what? I don't have them on
okay.
me. But she's hypothyroid. She's got vitamin B12 deficiency, vitamin D deficiency, hypertensive. She's lactose intolerant. Don't know if we should do anything about that.
During your oral presentation, don't get lost in details that are not relevant to the chief complaint and the HPI.
Dr. Fitz, she's got this long, complicated social history, which I think you really need to hear. She retired from SBC as a teletypist, 1971. Do you even know what a teletypist is? I, up to date, didn't have anything. And I really tried to look it up because I think it's important. But she lives at home by herself, and she's got these 4 cats. And I'm really worried about them. She's really worried about them. I think you need to be worried about them as well. I think we need to get social work involved here. I mean, 4 cats, one of them's sick, possibly. Maybe that's where she got sick herself.
Probably.
Tobacco, I don't know. I don't think that's as important as the cats, though.
I tell you what, Dave. Why don't we'll just go in and see her.
Yeah.
Probably save some
Sure?
time. Yeah, don't worry about it.
I got something here.
Well,
It's right. Wait. Shoot.
So you did your history and physical. You have a complete written documentation in the chart. And the purpose of the oral presentation is not to repeat verbatim every single piece of data that you gathered to your peers, to the intern, the residents, the fellows, the attendings, the other students who are on the team. The purpose of the oral presentation is to really put that information into an order or in an argument for what you think the patient's differential diagnosis is. Certainly, that same presentation will be different in different contexts. So you might be a little bit longer if you're presenting to other 3rd year or 4th year students versus if you're on rounds with your attending. Your goal should really be to try to make sure you can get all the key pieces of information in 3 to 5 minutes. You definitely need to practice doing that ahead of time. Don't just wing it, and the first time you give your oral presentation when it matters, you don't want to stumble on your words or at that point in time trying to figure out, well, what's important here. So the oral presentation is both the patient's story. You're going to take their HPI and their chief complaint, and then the rest of the information you've gathered, the past medical history and so forth. Again, you're just going to be pulling out what you think are the positives and negatives from that. They're going to help the healthcare team think the same differential diagnosis that you're thinking. Certainly the more knowledge you have and the more you climb up the hierarchy or the ladder of medical education, the better you get at this. So again, be patient as you practice this skill. You also want to make sure you really know your patient's story. Again, you're the one who spent the most time with them. And if you did your H&P at 5 o'clock on Monday evening and you're presenting Tuesday morning at 10 o'clock, go back to that patient's room the next morning, get an update on their vitals or re-examine them, talk to them, find out how their pain level is or whatever symptom brought them to the hospital. You want to have the most up-to-date information possible when you do your presentation. When you do your presentation, you're going to follow the basic same outline that you've learned for documenting the written medical record. And by that I mean you're always going to start out with the patient's age and their sex as the initial identifiers, because certainly a patient's age has a great deal to do with what diseases you think are likely to cause their symptoms. So you can always start out with their age and the patient's sex when you're doing your presentation. Again, give the HPI as a story, and you might want to include significant facts from the review of systems, the social history, or the past medical history if you really think they're pertinent and positive to help tell that story. For example, if a patient just had coronary artery bypass surgery 1 year ago and they're presenting with substernal chest pain, you might want to say that Mr. Smith is a 55-year-old male, status post 4-vessel bypass surgery 1 year ago, who now presents to the ER with substernal crushing chest pain. That piece of information is then relevant, and it should be part of the HPI because that's part of your pertinent positives. However, you wouldn't at the same point tell us that that person just had bunion surgery 1 year ago because that's really not relevant to a chief complaint of crushing chest pain. Certainly you want to, if you have some opportunity to read about your patient, you want to do a little bit of reading before you do your oral presentation. You have available to you throughout the hospital online search engines, up to date, for example, is currently at Loyola, textbooks, your Palm Pilots. Read a little bit about it so you're more aware of what those positives and negative factors are, so when you present the case, you're a little better informed. Again, that doesn't mean you need to do an exhaustive thesis or research project, but just even reading 5 minutes can give you that little edge to make you look more professional and let the team know that you have some knowledge about the patient. And while we're on that subject, certainly be professional when you're giving your oral presentation. Many times this is done in the hospital hallways, or it's done next to the patient's bed. Family members are around. So again, be careful with the words you choose. Never use slang words or demeaning words to describe a patient or their social history or so forth. Again, be professional. And certainly, if you don't know something, say you don't know or you forgot to ask that. Don't lie and make up a story. Just say you never would lie or make something up in the medical record that's written. The same holds true for the oral presentation. If you don't know something, say you don't know it, but you'll go back and ask the patient or their family members.